Hi, this is Dr. Antolak from theGentlDentist.com in Shelby Township, Michigan. And one thing that really is bothersome to couples is when one partner snores. Snoring is extremely prevalent, especially in our society, because of the fact that people are overweight, and if not all the time, but your body mass index is an indicator of your snoring and what takes place during snoring. What I want to do is just to take a moment to explain what it's all about and how snoring takes place, and then some dental applications that we can do to help with that problem. So snoring is basically an issue of when sleeping, especially sleeping on your back, your lower jaw is going to go back because of gravity. Okay? And then when you start falling asleep, your body, your tone of your muscles start getting much more relaxed. As your muscles and your tone of your throat relax, and if let's say you have if your lower jaw is too small in comparison to your upper jaw, which brings all that tissue back over the spaces where you normally would breathe from, in your pharynx it's called, or if you are overweight, that could be something that will restrict the amount of space that you can breathe through. So what happens is when someone snores, there's a vibration between the oral cavity as they're breathing in through the epiglottis and in that area, and so the tissue starts to flap, and that's the snoring sensation. That is a problem, especially for couples. One may have to sleep in another room because they can't sleep. So what do we do? There's a dental application that can be helped with this. If you know CPR, one thing that's taught is that if someone can't breathe through their mouth, what you do is you advance their mandible or their jaw. So you bring your jaw forward, that opens up the airway. Well, what we can do is use an oral appliance, a dental appliance like this, and this one is a very basic type of model, but it gives it for the indication. So if you had, this is for your upper teeth on top like this, these are your lower teeth, and let's say someone is sitting back like this and they're sleeping, normally the jaw would be positioned back further. So for example, the jaw would be positioned where, let me get these straps out of the way here, let's say for example like this, okay? Now what these straps do is it actually pushes the jaw forward, the lower jaw forward, and then it keeps the lower jaw pushed forward to keep that airway space open. When that airway opens up, then the snoring doesn't really persist as badly, so it keeps that lower jaw pushed up more. By doing that, it keeps the airway space open. And this device is, you can still bite down, you can move your jaw around like this, but you can't move that lower jaw back. And so when sleeping, when people start getting relaxed during their different phases of sleep, it can't go back, because during natural sleep, you go through different sleep cycles, and each cycle is a deeper sleep, a deeper level, a deeper level. The problem with snoring, and something even more serious called sleep apnea, is that adrenaline, and anytime that you start sleeping and you might hear somebody like starting to not breathe at all or start to gasp, that's a significant problem, because their body is not getting the oxygen that it really requires to sustain life and to sustain the activity in the brain. So what the body does, it creates adrenaline as they stop, and they wake up, and that adrenaline keeps them from ever getting down to the deeper levels of sleep that are necessary. So snoring and sleep apnea are significant problems socially and physically, and it counts for sometimes deaths. And it really is, if you can't get a good night's sleep, irritability, there's so many other issues that take place from that, as far as actually heart disease, potential high blood pressure, diabetes, are all affected by lack of sleep and sleep apnea. The first line of treatment by your physician is what's called a CPAP, which is a continuous positive air pressure. It's basically a Darth Vader mask that goes over your nose and over your mouth, sometimes just over your nose, and it puts pressure into it, so it forces that air down into your lungs to keep you ventilated. That's the gold standard. The problem is is that there are many people who cannot tolerate the CPAP device because it's something to wear on the outside of their face. It's got a certain roll to it, and it just kind of gets to be a little bit cumbersome and in the way. So these devices like this are a perfect situation for those of you or those you love who cannot tolerate a CPAP device or who are snorers. If this is something that you know that's going on, you may want to talk to your physician first. Request a sleep study. A sleep study and a diagnosis by a physician are necessary for us as dentists to treat sleep apnea because it is a medical condition. So if you have any questions about that or need some guidance, I'd be more than happy to help you out. Our number is 586-247-3500. Thank you.